All right. Good afternoon, everyone. My name is Shantae Davis Patterson, and I am the program director for California's Comprehensive Cancer Control Program. We are housed under the California Department of Public Health, and we administer CDOC, or the California Dialogue on Cancer. I'm very excited to be facilitating part of this meeting today because this is one of the meetings, our meeting that we have virtually that brings everybody in our coalition together. I know a lot of you work with us on different work groups and different committees, but this is the meeting where we all get to connect with one another. So really excited for everyone to be here today. All right, just a little few housekeeping notes. Everyone has been muted. And if you're not muted, please keep yourself on mute if you're not asking a question. You can also ask a question in the chat box. We are recording, as you have seen already. And we will also be sending this recording out on our listserv and post it on our coalition website. So our agenda today, we are going to hear from our chair and our co-chair and our vice chairs. We will talk about some comprehensive cancer control program updates, and then we'll hear from all of our CDOC work groups and liaisons. And then because we haven't met for an entire year, a fiscal year, we want to make sure that we are letting everyone know what our successes have been since the last time that we met. So we'll go over those successes as a coalition and then talk about the different activities that we're engaged in, have a couple of notes on cancer plan revision, and then we will open it up for discussion. And of course, we'll send out an evaluation. All right, so our CDOC leadership team, you'll see Dr. Sora Tanjasiri, Dr. Allison Herman, our chairs and co-chairs. Bridget Freely from the American Cancer Society is our vice chair. And then we have our Comp Cancer staff here. And I just want to give a big shout out and thanks to our small but mighty team. First, we have Joyce Paraico Seja, who's our coalition coordinator, and many of you will have received communications from Joyce for CDOC. And then we have Sheila Sinyo Gerhardt, who is our strategic alignment specialist, and she also works with the California Cancer Registry, but is a huge help for the Comp Cancer team and helping us get organized and coordinated. So I just want to lift up my team and thank them for all of the hard work that they do all throughout the year for the coalition, for the program, and of course, getting this meeting together. So thank you very much. And now I'm going to turn it over to our chair, Sora.
Hi, good afternoon, everyone, and thank you, Shantae. And I will echo the huge thanks to our entire small team of leaders with the California Department of Public Health. We could not do this without Shantae, Sheila, and Joyce. I just want to say hello and also say we cannot do.
Sora, okay.
Sorry, was I talking without on mute?
Just for a
Um,
second.
I just want to say that we could not do any of this work without all of you. We are a volunteer-powered coalition, and this has been an immensely busy year, both because of the future planning that we're doing with our 10-year strategic plan, with the growth that we're trying to do with our membership and our committees, and doing all of this with what we know are some pretty unique, I think, both federal and state challenges directly to the support for our comp cancer program. So I just want to say thank you, thank you, thank you. I know many of you who are on the call, and if I don't know you, I want to get to know you because without all of you, we would not be able to continue to vision and meet the needs of our very diverse and large population in California. So thank you, everyone. And thanks, Shantae.
And Allison, I'm going to turn it over to you if you have any words.
Thanks, Shantae. I just want to echo Sora's comments and thanking all of you for taking the time to be here today. It really shows your investment in CDOC. It's really exciting to see so many people on the meeting and all that you do through the work groups and crafting our new cancer plan. And we're going to really look forward to working with you to implement that plan as well, which is, we've spent so much time and energy developing the plan, and it's going to be great that we have a 10-year plan now, so we can, kind of take a breath and really focus on implementing that plan and working together to do that important work. So thank you for all that you do in your own organizations to support our diverse California communities, and we're in it together, and we'll keep working alongside one another.
Thank you so much, both of you. All right, so because we haven't met in an entire year, I also want to give a shout out to our new work group members and liaisons. And I just want to call them out quickly. They're on the slide here, but for colorectal cancer, we have David Russo with Cheeky Charity, Jeremy Starr Mendoza. For survivorship, David is working on survivorship as well. We also have Adeboye from City of Hope, Margaret Ling from Cedar Sinai, Gagan Bai, Monica Bryant, Ali Cormier, Margaret Ling, Alicia Hedge, Jasmine Escalante, Patty Brown, Veronica Fernay Berg. That's all for survivorship. For health equity, David is on health equity as well. Jeremy is on health equity as well. We have Zainab Josie, Nicholas Acuna, and Lori Long, who has joined our health equity work group. For lung cancer screening, we have Dr. Sarah Gandhari. And then for the CDOC State Cancer Plan, we of course had the Cancer Plan Advisory Committee. We had 17 members on there. We had over 100 subcommittee members helping to develop the state's cancer plan. We had data support from our California Cancer Registry and additional subject matter experts and contributors who contributed to the state cancer plan. So I just want to give a big shout out and thank you to all of these folks who are joining us and who are now part of the CDOC family. Welcome. All right, so now we have a quick breakout activity. This is something new that we're trying here with these meetings because we really want to give time for folks to connect. And we know that each one of you bring a unique perspective that's needed to achieve the goals that we have in CDOC. So we want to take a moment and have folks introduce themselves to each other. So we're going to break you out in breakout rooms for 5 minutes, and we're going to give, I think we're doing 5 minutes. Joyce, if you can correct me if I'm wrong. The breakouts are going to be 5 minutes. Yes. So in those 5 minutes, we'd like you to introduce yourself to someone. A lot of you may know each other, but some of you may not. So just introduce yourself and introduce the organization that you represent. If you don't have an organization, the purpose or like why you are a part of CDOC. And then also, how long have you been with CDOC? CDOC has been a coalition for over 20 years. So we have some folks who have been here just as long, and then some folks who have just joined us. So please, as we break out into the groups, again, your name, your organization, and how long you've been with CDOC, and then we'll come back together. And we'll also drop those instructions in the chat. So right now, Joyce, there we are. She's going to be assigning folks here into the breakout rooms. Joyce, do we just hit do you want folks?
I see a lot of smiles on people's faces, so hopefully those were good introductions.
Awesome. Thank you, everyone, for participating in that. I hope you met someone that you didn't know before. All right, and now I want to turn it over to our Vice Chair, Bridget Freely with the American Cancer Society. She's going to give us some updates.
Great, thank you so much, Shantae. And I thank you for the opportunity to give some updates on some of our work group work and from the updates from the American Cancer Society too. I know we have a packed agenda, so I'll run through this quickly, but we can go to the next slide. So as Lung Cancer Awareness Month is fast approaching in November, I can't believe we're already almost in November. I just wanted to share this great resource from the CDOC Lung Cancer Screening Work Group, which is our California Lung Cancer Story Map. This is a website that was created in partnership with our American Cancer Society Geospatial Solutions team, and it includes interactive maps and also a cohesive narrative about the lung cancer burden in California, and also the critical need to raise lung cancer screening rates in California, as our screening rates are quite low, actually. This tool has great county level data and educational resources about lung cancer and lung cancer screening. Please explore the site and share with your networks. The URL is getscreenedca.org. There's also a QR code you can scan. Shameless ask here, we are trying to get more visits to the site, so we would really appreciate your visiting and clicking through and just exploring it. And please share with your networks. But just a quick note as well, this is more of a resource for public health professionals or providers. It's not really a public or patient education tool at this time. We can go to the next slide. Also in November, the Great American Smokeout campaign from the American Cancer Society is launching. This is a campaign that gives people the opportunity, people who smoke, the opportunity to kind of have a day where they can commit to their quit journey. This year, it takes place on November 20th, and we have resources to help promote the day and also resources to help people quit smoking, which are available at this link and at the QR code linked below. We can go to the next slide. The American Cancer Society's National Roundtable on Cervical Cancer is also hosting a series of webinars about HPV self-collection for cervical cancer screening, as this is a really hot new topic. The first one is coming up on October 30th, and it's geared more towards FQHCs and safety net health systems. I've included a QR code and a link to register. It's completely free. And I do want to note that even though this webinar is geared more towards FQHCs and safety net health systems, I really want to encourage anyone interested in self-collection to join. We can go to the next slide. And my last couple of slides are just about some ongoing upcoming ECHO webinars for health professionals, so just learning opportunities for them. Some have started, but you should still be able to register and access past recordings based on what I've heard from our ECHO team at American Cancer Society. So the first one we have here is for prostate cancer screening and primary care. We also have an additional ECHO webinar series on fertility preservation and cancer treatment, as we know that is a popular topic. We can go to the next slide. And then we have two additional ECHO series, one on breast density and risk in primary care, as breast density information will now be included in mammogram reports. We want to make sure that clinicians are armed with the knowledge to discuss this with their patients. And finally, an ECHO on multi-cancer detection testing, really to help primary care clinicians understand the foundational aspects of these tests. The links to register and QR codes are in the slides. I know these will be shared after. And just one quick verbal update I wanted to mention is that our state HPV roundtable, the California HPV Vaccination Roundtable, is hosting an annual meeting on December 10th in Los Angeles. So if you're interested in attending, definitely reach out to us at CDOC and we can give you some more information. But now I will pass it over to Robert Park, our Government Relations Director for California from the ACS Cancer Action Network, or ACS-CAN as we call them, who can give some quick updates about the great advocacy and policy work that ACS-CAN is doing. Robert, I'll pass it over to you.
Great, thank you, Bridget. Great to meet all of you. So I have a few, no slides, but I have a few updates from our state legislative priorities as well as the federal. Starting with state, the governor did sign our Childhood Cancer Research Tax Fund into law. This would allow for California taxpayers to contribute a part of their refund, their tax refund, into raising funds for pediatric cancer research. The governor also signed our Enhanced Flavor Tobacco Enforcement Act, which raises the state tobacco license from 265 a year to 450 a year. And this is to generate revenue for state law enforcement to conduct inspections for the tens of thousands of tobacco shops across the state. Our tobacco-free pharmacy bill, unfortunately, didn't have enough momentum this year, so it became a 2-year bill and a high priority for us to engage with next year. And this would ban the sale of tobacco in all pharmacies across California. We're also looking into developing a bill for the new session, which will be coming up in a few months. And this is to cover the commercial private insurance, coinsurance cost for follow-up lung cancer screening. As you all know, California is ranked among the lowest for lung cancer screening rates. So we're hoping to cover the cost. Medi-Cal already does most of it, so we're hoping to have commercial plans cover it. On the federal side, today is day 21 of the federal shutdown. It's one of the longest government-wide shutdowns in history. And it's frustrating because there's really no resolution in sight. The Senate is back in town to keep voting, but from our lobbyists in DC, we're not very hopeful for a resolution, but hoping for a positive outcome in the coming days. As you know, the Democrats are trying to keep the ACA tax extension in place so that more Americans can afford insurance. We're also launching or ramping up our Protect Cancer Cures campaign, and this is to advocate for the highest possible funding increase at the NIH and CDC for cancer research. And we're holding events across the country and having people sign petitions like at our Making Strides Against Breast Cancer events. On a positive note, our Medicare Cancer Early Detection Screening Act is one of the most popular and co-sponsored bills by both Republicans and Democrats in Congress. This bill would have Medicare cover the cost for future technology and having blood tests detect multiple types of cancer at once. And this will improve treatment and survivorship for the Medicare population. And those are my updates. Thanks so much.
Thank you, Bridget and Robert, for those updates. Now we're going to do some CDOC and comp cancer updates. So since we are meeting for the first time since we received our notice award, I know a lot of you have already have this information because of other work groups and committees you've been on, but just wanted to report it out in this setting as well. We did receive our notice of award from CDC on June 30th of this year, and it was down to the day. So we are funded through June 29th of 2026. Our award was $442,000. That included $38,000 for a caregiver support project. We're working on contracting right now. We'll announce that project and the organization as soon as all of the paperwork has gone through. The funding for the other or the funding also goes to support our positions in the comp cancer program. So we have the program director, coalition coordinator. Then we also have funds for travel. This year, CDC actually wanted us to set aside quite a bit of amount of money for 3 trips, and one actually includes bringing some of our partners along. So you'll hear more about that a little bit later once we get more information from CDC, but it is unique in this year that CDC did allocate a large amount of money for travel this year. And then we, of course, have indirect costs, which actually do make a huge impact in our small budget. So and then I also wanted to note that we are going through the contracting process for 2 other projects to increase psychosocial support for cancer caregivers from carryover supplemental funds from last year. And I can report that one of our contracts has been executed and will be implemented by the cancer support community in San Francisco. So again, you'll hear more about that project as it progresses. And now I'll turn it over to Sheila to report out on the Cancer Centers Collaborative.
Thank you, Shante. So the Cancer Centers Collaborative originated from the Chapter 4 of the current state cancer plan. And this chapter recommends that cancer centers share best practices and collaborate statewide. As a reminder, we are still working toward objectives outlined in our 2021-2025 State Cancer Plan, which remains in effect through December 2025. So Shante will elaborate more on this during the Cancer Plan presentation. So the collaborative continues to convene quarterly with rotating Cancer Center hosts leading each session. Since our last members meeting in 2024, we've already hosted 4 convenings with our Cancer Center representatives. The slide highlights the topics covered during those sessions. Our next collaborative convening will take place tomorrow with our Cancer Center host from the Providence St. Joseph Hospital, which is located in the rural city of Eureka in Northern California. And then let's go on to the next slide. As a quick reminder about the CDOC orientation webinar, we consistently post and remind workgroup members about the orientation webinar to keep it visible for both new and existing coalition members. It's a foundational resource that helps people understand CDOC's structure, mission, and how they can get involved. So we've included the orientation webinar in workgroup meetings, newsletters, and on the CDOC website. So this approach directly responds to feedback from previous comp cancer evaluation findings, which highlighted a lack of clarity around how to get involved with CDOC or limited understanding of how coalition roles, work groups, and ways to contribute to CDOC. So by incorporating and embedding orientation access into multiple touch points, we're working to bridge those knowledge gaps and support more meaningful participation from everyone. We hope this helps you reacquaint yourself with CDOC and feel more confident about how to engage, as well as encourage others to join CDOC. And next slide. I'll pass it to Joyce.
Thanks, Sheila. We just want to remind everyone that CDOC welcomes all of our members to spotlight their work or recognize an individual who has done great work in cancer control. We encourage you all to share information about your project or a colleague that's doing work in cancer control by completing a form, which I can drop in the chat. And your submission will be featured on the CDOC website, listserv, and other forms of communications. And the next, CDOC launched a new initiative called the Partner in Focus. This spotlights one dedicated coalition member each quarter. The goal of this Partner in Focus is to foster connection, collaboration, and inspiration throughout our CDOC community. So you'll see these quarterly highlights shared via the CDOC listserv and on our website. And then you can hear the unique roles and voices that help kind of strengthen our collective of cancer control partners. We have a partner event that we'd like to highlight as well. Earlier this year, CDOC and UCSF collaborated to host a webinar featuring Find Help, which is a platform that allows community organizations, governments, healthcare organizations, and other businesses across industries to manage and coordinate care. This webinar equipped participants with the knowledge and tools to access quality services throughout utilizing the Find Help platform. So just think of it as like a search engine. But now I just wanted to highlight that Find Help is now hosting an in-person summit in San Francisco, October 23rd, and we'll be dropping the link in the chat for more information regarding that if you're interested. And now I'll pass it back to Shante.
Thank you, Joyce and Sheila. Well, I want to give some quick updates on the California HPV Vaccination Roundtable. And for those of you who don't know, the Roundtable is a separate coalition. It's a sister coalition of CDOC, and it was co-founded by the American Cancer Society and CDOC back in 2018. And so one of our groups that we have under the Roundtable is our parent work group. And they have, they started California HPV Vaccine Week a few years ago. It's always the first week of August, and for this year, it was a huge success. We relaunched our website with survivor video, social media graphics, and resources for health professionals. We shared impactful social media testimonials from leading vaccine influencers. We secured news coverage in Sacramento highlighting HPV vaccine as a cancer prevention, and those were done by champion physicians. We hosted a Start at Age 9 webinar with over 100 attendees. And despite not running our ACS-led paid campaign, we estimate that we reached nearly 100,000 people throughout for all of the outreach efforts that went on during HPV Vaccine Week. And I also want to say with HPV Vaccine Week, all of the materials that are created each year for this important awareness week are available and can be used all year round. So you can go to our website. Joyce, if you can drop that link in the chat for folks to go get so they can access the materials for HPV vaccine awareness. Thank you for that. Another group we have is our data work group. And they did an analysis of the California Immunization Registry, HPV vaccination data, and California Cancer Registry data on the HPV cancer burden. So you can see the most up-to-date reports that they have worked on our website yes, the California HPV Roundtable website. And then the provider and health systems work group is still coordinating an announcement approach training. This is a training that's free, it's virtual. It is designed for healthcare providers to be able to increase HPV vaccination. And if anyone is interested in that training, I'm actually the contact for that. So I can help organize that training. Again, it's free. And we do have CMU or CME credits for continuing medical education credits for that particular training. So let me know if you're interested in that. We are also continuing to host our quarterly learning collaborative. We just concluded our last session of the year for 2025 last week, but we are continuing in January of 26, and you'll see the dates there. You can find more information on those and register for all of those sessions. Those are 45-minute sessions. We call them lunch and learns. So come and learn about HPV vaccination. We always have a great speaker for those and great turnout as well. And you can also view those past recordings on our website. And then just a note for the meetings, we hosted a virtual webinar health plan forum on advancing adolescent immunization last August. And that was a very successful webinar where we had a lot of health plans attending. And then as Bridget mentioned, we do have an annual meeting every year. Last year, we were in Sacramento, and you'll see the group of us there at our December meeting last year. So, all right, and now I'm going to turn it over to our work groups and liaison leads, and we want to start with Dr. McCarthy.
Great. So the American Cancer Society estimates that 5% of cancers in men and 11% of cancer in women in the US are linked to having excess body weight. To reduce risk of obesity-related cancers, the Nutrition and Physical Activity Work Group has recommended 4 different approaches to boosting levels of the well-known satiety hormone, glucagon-like peptide 1, also known by its abbreviation GLP-1. And these approaches include increased regular aerobic physical activity, which has been shown to increase precursors to GLP-1 expression, increased daily consumption of fiber-rich, polyphenol-rich foods, such as foods that comprise the Mediterranean dietary pattern. Fiber and polyphenols boost precursors to GLP-1 expression. Polyphenols are also antioxidants, which help keep inflammation low. Minimizing inflammation is a separate pathway to reducing cancer risk. 3 is decreased daily intake of ultra-processed foods. The added sugar, added saturated fat, and added salt in ultra-processed foods are pro-inflammatory. The more reliant we are on ultra-processed foods for our daily nutrition, the lower our endogenous levels of GLP-1 and the higher is our level of systemic inflammation. Finally, for those who cannot achieve a healthy weight through adhering to healthy lifestyle practices, the Nutrition and Physical Activity Work Group advocates increased patient access to GLP-1 drugs. The patient information that accompanies the GLP-1 drugs recommends regular exercise and healthier food choices. So GLP-1 drugs are not expected to be standalone solutions to obesity, but rather a complement to the lifestyle recommendations just reviewed. So we are projecting that public health support for these 4 different approaches to boosting GLP-1 will result in a 15% decrease in obesity prevalence in California over the next decade. Thank you.
Thank you, Bill. All right. I don't know which one, Margaret or Stoney, you want to go first?
I'm first.
Okay.
I think, can you advance somebody? Yes, thank you. Okay, so C4, so that's our abbreviation for our organization, in collaboration with CDPH and Department of Healthcare Services, have a project that's called the Breast and Colorectal Cancer Implementation Project. And for that, we are actually funding evidence-based interventions as they relate to both breast and colorectal cancer, largely in part because they have overlapping screening ages. And so we cycle 3, I'm losing track of. So cycle 3 ends at the end of December. So they're what are we, 10 months into their funding. And so this is the list. If you're interested in what they're actually working on, we have certain requirements. The requirements for this program are that you have to be an FQHC, you have to commit to focusing on both breast and colorectal cancer, you have to be an Every Woman Counts provider, and you also have to use a clinic champion that can help marshal your efforts further along. So on our C4 website, and I think also on the CDOC website, there's a listing of what the projects were funded, where they're located. So by county, it includes the abstract, it includes the priority areas or I lost track of that part of it, but it also includes the project director and the funding amount. And so we currently have a cycle 4 application that is open, and I kind of, if you scroll back under the chat, I put the information and included the link as to where that is. The application closes on November 5th, which is a Wednesday at midnight. And funding starts January 1st. And it's the RFA and the priority areas pretty much reflect what we had for cycle 3. It's just we're trying to reach a broader audience. So next slide. So we have upcoming events, and just to so for people that might be interested, we have the Western Colorectal Cancer Consortium Conference. It will be again back at UC Davis Conference Center, October 1st through 3rd. So it's going to basically start at noon on Thursday and run through noon on Saturday. And so those updates will be posted on our C4 website. And then as part of our community outreach, education and awareness, and also any proceeds from our runs help us partially fund some of the community grants. So we have our existing Screen Your Gut, Save Your Butt race that's in San Diego, which is scheduled for March 28th. And Stoney might want to say a little bit more about that. But we're also adding a second run. And so this is a Northern California, so it's called NorCal. So it's still Screen Your Gut, Save Your Butt, but it's NorCal. And so it will actually be on campus, closed campus, and we will be offering a 5K and a 10K in addition to a one mile walk. So Stoney, did you want to add about San Diego?
It's our 4th annual Screen Your Gut, Save Your Butt. It's a time 5K and a walk, and the 15-year-old Daniel Anderson, my grandson, was third last year, and he thinks he can win it this year. Hopefully he'll get the rest of his cross-country team there. So it's a fun event. It's on a sunny day in March 28th, and right beside the bay. It's a beautiful area. And the blow-up colon's always there. Next slide, please. A couple of things that are good news. First, our federally qualified health centers that both the BSIP program and the C4 grants program works with, we're now above the national average in our federally qualified health care screening rates in colorectal cancer. So some of our grant work has really helped. And the second thing is the Medi-Cal screening rates have now been published since 2022. And CMS has published them both in 2023 and 2024, and we're well above national averages in our Medi-Cal screening rates. And some of it is because the work we've been doing with the Department of Healthcare Services and Medi-Cal managed care. And as part of that effort, we're going to have an education for the health plans that are the Medi-Cal managed care health plans on December 4th. And not only will we be covering colorectal cancer, but we'll also be covering breast and cervical cancers. And we'll have a panel of health plans people talking about sharing their best practices of how to increase this. And it's very interesting. There's a lot of information on how to increase clinics screening rate in all of these cancers, but not a great deal of information on how to increase health plan screening in all these cancers. And we hope this webinar and any subsequent events will help close that gap. So registration will be coming soon. That's our main efforts, but I'm very encouraged by our being above average now in both our federally qualified health centers and our Medi-Cal managed care. And the other good news, possibly, Medi-Cal managed care colorectal cancer screening rate is a report-only measure in 2025, and we hope that in 2026 it will be a minimum performance level measure, which requires the health plans to pay a lot more attention to it. And NCWA is now recording. It's one of their measures that has weight on their STAR system in the Medi-Cal in 2026 also. So we're hoping that will happen. So any questions for Margaret or me? Okay. The Health Equity Work Group.
Yes, I think.
No, I'm sorry, I was on mute and I was trying to.
Go ahead, Margaret.
I wanted to add one extra thing. One of the things that we're also trying to work on is the fact that, so for colorectal cancer, because you can send tests out to patients, and so you have the insurance plans doing that, and then you have health systems doing that. We're also hoping that with our efforts, because ultimately if a patient tests positive, they have to land back at their medical home. And so by our efforts with the plans, we're hoping to reinforce that connection so that patients get appropriately followed up if they have positive primary tests. And so that's also part of why we're, have all the different silos trying to work together.
Yeah, and we're working with national groups to make that a measure that can be part of the uniform of the national measure set, like colorectal cancer and breast cancer and cervical cancer is on the U.S. Preventive Services Task Force. Okay.
Great. Thank you both. I think I'm going to call on Sora. I'm not sure if Kimlin and Shannon are here. So yeah, go ahead,
I
Sora.
don't think either of them are here. So thank you, everyone. So just to do a brief update, do we have a slide for the Health Equity Work Group? Yes, thank you. So currently we are still completing a multi-year project that has been focusing on underrepresented data project. We have been, I think I can say, very interested in getting to an idea of what kind of needs, or I should say, what kind of data cancer centers collect, particularly around our sexual orientation, gender identity, but certainly as it compares to race, ethnicity, age, income, et cetera. So we have completed the Cancer Center survey. I think you've heard of all this before if you've been part of our yearly updates. We completed the patient survey. There's currently a provider clinician survey that's been, the protocol's been completed, and we're recruiting sites to implement that. And the community survey is also in process. We want to note that due to alignment in federal policy, this is not a program that is falling under the CDOC facilitated project. So this is something that is actually being spearheaded by Shannon Kozlovich. But we are grateful to CDOC for having launched this and being a partner from the beginning. But we are taking this and continuing to complete it, but making sure that we adhere to federal policies and not using federal dollars to support this. I hope I said that appropriately. But again, it's very collaborative. We invite anyone who's interested. We have very interesting findings. We're hoping to work on a manuscript and all of this stuff. We're again hoping to disseminate so that we are benefiting and improving at least the visibility of what we think has been a long invisible population with obviously true cancer needs. I can't remember if we have another slide. Is that that's the only slide? Since we are winding down on this project, the Health Equity Collaborative is doing two things right now. Number one is we're taking suggestions for a second project to adopt. We think that the focus on underrepresented populations obviously is our core concern. And we know, or we suspect, that there are a lot of emerging and ongoing issues that are either presenting significant barriers to and or ongoing concerns about accessing quality care all the way from, prevention all the way through treatment and survivorship. And so we would invite anyone who's interested in using an equity lens to join us to identify what that project will be. We think that it's going to be focusing on access, but we are of course going to be engaging with our members to ensure that we're making the best use of everyone's expertise. The other thing that we are undergoing, and I'll just share here, is that we're considering a change to the name of our committee. This is not being required by our funder or by CDOC, but we do think that, given the current, context, we want to make sure that the work on focusing on underrepresented populations doesn't get lost just because of the words we use in a title or not. And so we're also considering how that might better represent what we do and continuing to move the work forward. We're obviously going to be we've already had a vote within our committee, and we're still trying to figure out what makes the most sense on a state level so that the work continues to get understood, but perhaps not confused with another collaborative or committee. So stay tuned. I'm sure you'll all be holding your breath about what our new name will be. I think that's it for us for now. Thank you.
Thank you, Sora. Now for our survivorship updates, I'm going to turn it over to Daniel Rivas.
Good afternoon, everyone. Sorry. So quick update. One of the areas that we've really been focused on for survivorship is the leveraging of the community health worker workforce, and how do we lean into that workforce to help us with survivorship, but also screening, so from prevention to survivorship. And so we were creating what we call a cancer specialty community health worker project to integrate cancer care specialty into the state CHW certification program. Hopefully we can standardize training and improve cancer survivorship outcomes. So it really is about building a curriculum or some sort of training standard that can be used throughout the state.
Thank you.
Next slides. Do we have any more bullets in there? Sorry. And one of the areas we've been working with is HCI to help guide us in the process of integrating or getting those standards approved. And I know HCI is working with a community-based group to identify and agree on standards for community health worker curriculum. So we're hoping to be part of that process as well as they standardize trainings for community health workers.
Thank you, Daniel. Okay, I think before we move on to the state cancer plan, just want to pause to see if anyone has any questions so far. Okay. All right, so with the state cancer plan update, I just wanted to give a quick overview. I know most of you know we have just completed the 5th iteration of California's state cancer plan, but this is just a reminder that we started back in 2004. And so now we're here with the 5th iteration that is currently in the CDPH approval process. I also wanted to remind folks that we are still working on projects that have come directly out of our current cancer plan, which goes through the end of this year, the end of 2025. And we do have a cancer plan dashboard that is measuring progress for all of those objectives in our current cancer plan. We won't have data to do a full evaluation of this current cancer plan probably until 27 or so. But we'll keep everyone updated on when that happens. But just wanted to also, again, just note that we're still in our current cancer plan because the current cancer plan the new cancer plan to come has not yet been approved. But what we are doing and actually this slide here just kind of goes over the process for, and again, I know a lot of you have seen this, but it just kind of gives an overview of the new cancer plan. So it's 26 through 35. It is our first 10-year cancer plan. It focuses on health equity and prevention to eliminate disparities and improve outcomes for all California communities. We developed this plan. We started back late 2023, and then we finished it earlier this spring. And as I said, it's currently in the CDPH approval process. The plan will be available exclusively online. So last time around, we had a PDF for the plan. And this time around, it will be beautifully laid out on the CDPH website, accessible through the CDOC website as well. And we are working on implementation guides for the plan right now. So our implementation guides are being developed by a separate committee. We just form a committee. I know a lot of you on this call have joined that committee. Thank you so much. We recruited, I want to say, over 20 folks who wanted to help on this, but they basically are one-pager fact sheets. And this one here was drafted by our intern. It was sort of a result. It was a result from a survey that we put out on the what can you do portion for the plan. So we do have this a section in the new cancer plan that says what can you do if you're a Californian, if you're a health plan, if you're a physician, et cetera, all of these different groups. So now we're translating that piece into these one-pager implementation guides that can be shared once the cancer plan is approved. So we can direct people to, the link of where the new cancer plan is, but we'll also have these implementation guides that will give folks a quick snapshot, because there's a lot of content in the plan that we developed. So these implementation guides will be for specific priority groups that have been identified by the Cancer Plan Implementation Committee, as well as the survey. They're pulling all of the information from that as well. So those are coming soon. All right, so now I'm just going to go over quickly some of our successes, because I know a lot of you who may be new or who may not be on a work group or committee. You get the newsletter here and there, but what are we truly doing? What have we done throughout the year? So I'm just going to give a quick list on some of our successes in the past year. We continue to convene the CDOC Cancer Centers Collaborative. Last year we've convened 4 meetings, averaging around 45 folks from cancer centers in those meetings. We've also have a CDOC Cancer Surveillance Data webinar where we present different topics around surveillance data, and we presented 4 webinars reaching more than 95 members this past year. We also have a California Cancer Control leadership team that brings together leaders from CDC funded and other cancer programs, and it's a group where we can identify different opportunities where we can collaborate on or see where there may be duplication, etc. We also have the breast and colorectal cancer screening implementation project that Margaret reported out on, and there's no report to do on that because we've heard about that. So the BSIP program, also the underrepresented data project, and Sora just provided an update on that. And I just provided an update on our cancer plan revision activities. And just, a quick recap, we had around 120 individuals involved in that process. So it was a huge undertaking, but it was mostly all of you helping to put all of this together. So yeah, that was another one we can check off for this past year. All right. So CDOC activities for this year. So this is fiscal year 25-26 that goes through June of 2026. So our current work, as Stony mentioned, we are putting together a cancer screening webinar series in collaboration with Department of Healthcare Services, American Cancer Society, and the California Colorectal Cancer Coalition. So this is the screening webinar that Stony was talking about. We also are working on state cancer plan implementation, as I said, with the implementation committee that's being put together. And then we're putting together a dissemination plan, obviously, for the state cancer plan. We're working with the California Cancer Registry to provide data to our subcommittees. We're coordinating coalition meetings with coalition membership. Also coordinating convening meetings of the CDOC Cancer Centers Collaborative, and then all of the work that we talked about in our survivorship work group with the psychosocial support projects, as well as the CHW project that Daniel talked about, and also work of the California HPV vaccination roundtable as well. And another thing that I don't know why it's not on here, is work with our lung cancer screening work group as well. Oh, here it is. There's a continuation. We are continuing the CDOC Cancer Surveillance Data webinars. So look out for those dates that are coming. Sheila, I don't know if you have those yet or not. We're continuing work on the underreported project that Sora reported on, our health equity work group. We're also going to be working with the Cancer Network, which was formerly known as the LGBT Cancer Network, to implement some cultural competency training. We'll be doing that in the spring sometime. And yes, we are coordinating with the California HPV Vaccination Roundtable. And as I mentioned, we on the CDOC side, we lead the health systems and providers work group. We're also recruiting non-traditional representatives as part of the coalition membership. And we are always working with our CDOC evaluation team on evaluation. All right, that was the end of our activities. And now I'm going to open it up for first Q&A, if anyone has any Q&A or any announcements that they want to announce to this group. This is an open platform. We have about 25 minutes left. Updates, discussions, and we'll have Margaret kick it off for us.
Just because I had to get mine in first.
Yeah.
I saw that Mark is on here, so I'm going to ask, because I think Mark is still on here. Any estimate when we're going to get the more recent data release from the cancer registry?
Ooh, I have to get back to you on that. Let's see, where should we be? I'm thinking about the larger cycle. But no, I don't have any updates on that one. But I will get back. I'll relay that back to you.
Because the most recent has been 2002 for quite some time, and I think that SEER has released the 2023, but the registry hasn't. And then I just checked CDC right now, and if you do the state level from the CDC, they're only displaying through 2021. And it's kind of because we're just in that critical window of, getting through that early stages of the pandemic and recovery processes. And so where we're looking right now would be kind of helpful for some of our policy efforts.
Thank you. And I think I have a little more info to convey. So we are, I can understand why the latest from CDC is 2021, because we haven't submitted let's see, it should be 2023 data. I mean, CDC should have more recent, but our submissions come basically 21 months after the close of that calendar year. So right about now, in about 2 weeks, we're submitting. No, I'm sorry, it's the end of November, so it's 22 months. We're submitting our data for 2020 calendar 2023. So that's our sort of clean up and get it all scrubbed for the feds, and then we start to make that available in-house. And then the feds are, of course, behind, and given the current federal situation, they'll probably be delayed even more to get it out. But we will have it. It'll be available from our side kind of in the let's see, it'll be November 30th. We do the submission, and then after that, a month or two, I would hope.
Okay. And do you know and at that point, whether or not Scarlett and the maps that link to the MSSAs, do you know if Scarlett plans to integrate the most recent data set into that? Because that's from a policy perspective, it's very helpful.
Yeah, you mean in what's it called? California Health Maps, I think it's called.
Yeah, the health maps. Thank you. Yes.
Yeah. No, I think that's an awesome product. And yet they did that has old data in it now, because they did that based on some additional funding we had about more like 10 years ago, because we haven't had any sort of surplus funding in recent memory. And so no, there's not a plan to update that. We do have updates. We will be updating our late stage mapping, but that will take, well, obviously, for the latest data won't be there. But no, I don't. Unless Scarlett has another funding source, I don't see those getting updated.
Okay.
But I will remember that as a plug for that product, because I love it. I mean, I think they did a great job.
Yeah. Okay. Thank you.
Yeah, the
Sure.
late stage data was extremely helpful.
Awesome. Really appreciate that feedback, Dr. Anderson.
I think I'm next. I'm going to jump
Yeah,
in
go ahead, Sora.
because we might as well just put Mark on the hot spot. Or no, he's not on the hot spot. He's very eloquent. I am curious, Mark, with the new, or not new, it was earlier this year that the OMB Directive 15 was updated to include that new racial category, Middle Eastern,
The MENA,
North African. Yeah, I'm kind of curious. I've never heard about what the rollout, the plan, the timeline would be for our cancer registries. So do you have any comments on that?
That's a good question because I know that that is now in the CDC. We call it CDC REC, CDC racial ethnicity categories, I think it is, or maybe some. Anyway, it's in the formal CDC layout. However, we go by that. There's you're familiar with NACER, right? North American. Good. That's, we work with the layout that they give. However, we are now in CRDMS, which is, of course, the NCI system, measurement information system. So I think it should roll out. Let's see. I mean, I don't know if it's going to be in the 23 data. Wait a minute. When did MENA get pushed up to at the federal level? I don't think it was that recent, so I don't think we're going to probably see it for a couple more cycles. I don't know if like 23, let's see, 23 should be, as they say, 23 will be coming out, and I honestly, Stoney, I think I was a little ambitious to say in the next month or two. It's probably going to be early next year to be available. And I don't recall if we had, because there's this long process where, it's decided on, we need this group, to this MENA group, then it gets into OMB, it goes through, into the data system, and it has to get out to the EMRs, right, where they're actually collecting the data. So I don't know where that is, but I will find out and I'll let you know.
Well, thank you, Mark. And one thing that I'm wondering, and I'll just throw this out to all the CDOC our members and our leadership to consider, is whether CDOC wants to play a role in recommending how cancer centers also meet the requirement. Because we've got to report to you that we've got MENA patients.
Yeah.
And I'm unclear about whether the degree to which we've got, the capacity at our local ends to do that, and where we get that kind of, we haven't changed racial category collection for a while. So I'm just putting out there if people are interested.
Yeah.
Maybe that's something our health, our underrepresented project, committee can actually, our projects can consider too. Thanks, Mark.
Yeah, no, that's a fantastic connection point because it is, there's also a state bill. I believe it's been chaptered now. I thought it was AB 91, but I'm dealing with a lot of policy issues. Then I kind of confuse them sometimes. Allison, I was thinking of it as you presented. Um, so yes, that's another thing. And yes, I think you're echoing just what I was thinking is, CCR data, as I explained to you, it's got this larger kind of data universe or regulatory universe we live in, and that's the sort of the information system as well as the NACER piece, and then it has to be collected at the facility level, of course, to get it to us. But there's other data that's being collected by the cancer centers, and is that being put in? Is that something we want to take on in that underrepresented group? All good thinking.
Thank you. Anna.
Hi, I'm with the Indian Health Service, and earlier this year we embarked on the very first cancer patient navigation training, and so we successfully worked with the help of UCSD and UC Davis COE staff to train 42 staff from tribal and urban programs, representing 17 tribal and urban programs in the state, for cancer patient navigation. In that dialogue and through my own learning and investigation, it seems that while we can do Medicare B, California has not adopted coverage of principal illness navigation for those G codes, and the word I was getting is that they should bill under CHW, which is great if it's CHW's doing work. But it's roughly a third of the reimbursement that those navigation G codes are. And half of the staff we trained were RN level and half were CHW. And so I don't know if that has come up for anybody else. I know as I visited well, I don't want to name any names, but one of those comp cancer centers where we did an orientation and tour for the navigator trainees are looking for reimbursement as well and not able to bill Medi-Cal for those services. And so if there's anybody that wants to partner in terms of advocacy, I'm at the federal level and can't really do too much, but can hold space for other organizations who maybe want to have discussions and dialogue about this.
Very important. Thank you, Anna. Margaret.
Yeah, so I want to just come back to the kind of the discussion and just kind of putting it out there is, you know, I'm unfortunately a frequent flyer for my health system and kind of thinking on the implementation side, if they're adding in new racial ethnicity categories, you know, I often see, like maybe at least every 6 months, what's my you know, gender identity questions, but it kind of occurs to me that I've never seen probably the equivalent for how people identify themselves from a racial ethnic perspective, right? And so some of these, it kind of gets back to, you know, the old days when it was just Asian Americans and then realized, okay, well, there's subcategories that are at higher risk. We need to start capturing more discrete and granular data. In kind of back to Sora's comment about the implementation component of it into the health systems that are capturing data, I'm going to suggest that there probably needs to be a robust effort to also make sure, maybe go back and re-ask everybody, what do you currently identify as, right? So, because, you know, maybe you were lumped under some category before, and maybe now with the new categories, you're no longer falling into where, say, the registry would think they would naturally categorize, or even your provider. So, you know, and my perspective is that, you know, when I was married, my married name was Rodriguez, and unbeknownst to me, my school district had labeled my child as being Hispanic, and her dad's relatives had immigrated from France, but the immigrant happened to really like the name Rodriguez when they came through Ellis Island. So, you know, so it's, you know, if we're really looking at it from what's the, you know, are there specific things within certain racial or ethnic groups that are in play for cancer development, we might want to make sure that we actually have accurate data of where people think they fit. So, sorry, that was a lot of hand waving, but I do think that we, you know, the other example is like the Russian population, right? So it gets lumped into the Caucasian population, but if you have that large immigrant population, they may actually be wearing a slightly different risk factors because of that, where they came from.
Thank you, Margaret. Sora, I don't know if you got my note. We have about 10 minutes, 12 minutes left. What are your thoughts there?
Oh, sorry, no, I didn't get your note. So, well, I guess we could certainly leave it up to the wisdom of the group. Maybe Allison. I don't know if Allison, you've got some ideas too. I don't want to let everyone go because everyone's here, and I love the fact that we're all here.
Yes.
But of course, if we're feeling like we've covered everything that people want and hope for, we can give everyone back some time.
Or if anyone has any last updates or anything that they wanted to share with the group. Okay, go ahead, Stacy.
Oh, actually, Allison also.
Oh,
unmuted.
Allison.
We can let
Sorry.
Stacy go first, and then I was
Okay.
just going to chime in with maybe an idea.
Okay,
Okay,
I
perfect.
was just, while we had Sora, Miss Sora on the line, I just wanted to see if she could speak a little bit more about the equity group, and what direction they're going in or what they'll be working on. That would be very helpful. I think listening to some of the upcoming like what the challenges they'll be working on, as you know, separating and renaming.
Oh, I see. Yeah, so the name change is actually something that we've been considering now for a bit. We've come up with different options and we've narrowed it down. So that one, I think, just stay tuned. We hope to have a name that captures all that we're doing in ways that everyone feels included is soon to come. If you're asking what I was referring to about we're brainstorming our next project, a few things that have come out of the woodwork, I think, as possibilities are really focused on our concern about restricting access, both in terms of, federal support for the Medicaid program, the Affordable Act, Affordable Care Act, some things that are going on with our immigrant communities, what we think might be some constrictions on, rural communities and their access because of the changes to payment to providers might be restricting those who even take, Medicaid, particularly in rural areas. So I'm sorry, there's not one singular idea right now, but I think the Health Equity Collaborative is very concerned about all the things. We know this, we suspect at least this dovetails, there's going to be overlap with some of the other committees and collaboratives, right? And so one of the things that we are trying to do is both identify areas that we'd like to focus on, and then to reach out to make sure that we're carving out something that would be unique and supportive to what everyone else is doing. If you have any ideas that you'd like to throw out, please either say, share, or use chat. I'm monitoring chat for our collaborative to consider. Actually, wait, are you a member of our collaborative? I'm so sorry. I don't remember.
Quick clarification, the State Cancer Plan Health Equity Subcommittee is different from the Health Equity Work Group of CDOC.
Oh,
yeah.
I'm so
But
sorry.
no
So
worries.
you were asking about the plan, the committee that's working on the cancer plan? I should have asked that
No,
in the
I'm
beginning.
sorry. Yes, I was talking about your new equity plan that you're starting moving away from CDOC. That was the one you're talking about, I believe.
Oh, okay. Oh, good. Phew.
Yeah. You're right on track. Health equity has a lot of context to it. So I basically was very interested in seeing where you guys were going with that and what you're going to start working on, or what you're looking at
Yeah,
in terms of health equity.
And if anything I mentioned is of interest to you, please feel free to put your, say so, and we'll be eagerly include you in our.
I will put my contact information. Health equity is my space. Yes.
This is exactly why we have these. We usually have them in person where we'd be like, water cooler on the way to the bathroom making these connections. So hopefully people are making these connections as we are gathering today. Thank you, Stacy.
Thank you.
Thank you. All right, Allison, I'll turn it over to you to close us out.
Okay, was there one more hand up? I just want to make sure we include everyone since we do have 7 minutes. No?
I didn't see anyone, but please. Oh, that's Ashley Ojig. I think I saw your hand up. Or do you still have a comment or question?
There you are.
Okay, now that I've put on the spot, I just want to say hi and introduce myself. I'm new to the group. I'm from Alameda County Tobacco Control Program, working on cancer initiatives, and I really want to get involved with this group and applaud all the work you've done. And I would love to join some work groups or subcommittees, but I'm not sure yet which ones or how, but I'll figure that out. Hi, everybody.
Thank you for introducing yourself. And yes, you and I had a meeting, and I'll follow back up with you on that for sure. And thank you for coming off mute and doing that. This is exactly what these meetings are for. So that's great. Thank you.
Yeah, appreciate that. And nice to meet you.
Yes.
Okay, David, I see your hand also.
Yeah, real quickly, I just wanted to let people know about a new coalition that's formed across California. It's called the Public Health for All Californians Together Coalition, and it's kind of pushing back on stuff coming from the federal administration, like dissolving the ACIP, which affects vaccine recommendations, could affect HPV recommendations at some point, and also the potential dissolution of the U.S. Preventive Services Task Force, which could affect how cancer screening is, the guidance that we receive or coverage we receive. So I'm going to put some information in the chat related to our kickoff meeting on September 26th and related to CDPH's new webpage called Public Health for All, where you'll be able to find information as it unfolds. I don't want to prevent people from getting 5 minutes back in their day, but I'll just put this stuff in the chat real quick.
No, that's great. This is great information. Thank you, David.
Can I just chime in? I put a question in the chat. Thank you. I'm so glad I joined today. There's been so many nuggets, and I hadn't heard of that new coalition, but I put in the question back to the discussion on California Health Maps and the Cal Data Explorer. Does anyone know, is there anything California Health Maps has that Cal Data Explorer doesn't have? Obviously, the Cal Data Explorer is more recent in that it has 2022 data. It doesn't sound like the California Health Maps is going to go past 2021 anytime soon. But am I missing anything there with, like, why you would go to California Health Maps instead of the state's Cal Data Explorer? Is it just the visual representation?
No, they actually have, so they have like, and I don't think the Explorer has the granular data that the maps had. So the maps had the MSSA. So if you were doing
okay.
policy
And
work in
congressional
California,
districts. Okay.
congressional districts, right.
That's what it is.
And
Okay.
it was, we used an iteration of that before there was that actually website for some early legislation that we did years ago. And it was very effective to walk into a legislator's office and say, here's what your district looks like compared to the rest of the states or the rest of the districts in the state.
Okay. Yeah. But I do see it's only incidence, not mortality.
On the you can search for mortality on that one.
Okay, let me poke around with it. Thank you, though. That's the big thing, the granularity.
Yeah. Maybe ACS can fund it. And David, I'm really interested in the one that you just I'm interested in your link there.
Mm-hmm.
Yeah, please check it out.
All right. Allison.
Okay, so there, we did it. And we did get to meet each other almost like in person. So thanks to everyone for joining and giving us your time and your energy and sharing all of these ideas and resources. I think that is the biggest value that CDOC brings. There's so many wonderful things going on across our state, and it's really impossible for any one of our organizations to stay on top of it all. So it's meetings like this that really help us to share these resources. So we will look forward to working with all of you as we move forward and to seeing you again in likely a smaller meeting. Take care and enjoy the rest of your Tuesday.
Thank you, everyone.
Thank you.
Thank you.
Bye-bye.